Picture this. Someone in your group starts acting strange. Not sick, no fever, no wound, no visible injury, but something is wrong. They stopped sleeping. They're hearing things nobody else can hear. They're staring at walls and talking to people who aren't there. Or they've gone completely silent, stopped eating, stopped moving, like something inside them switched off. You have no doctor, no hospital, no diagnosis, no medication, and you have no idea what is happening to them. This was the reality for every human group for 300,000 years. Mental illness didn't begin with the modern world. It has always been here. And the way ancient humans responded to it reveals something about our species that most people never learn. They didn't abandon the person. They didn't leave them behind. They tried to help, and some of the methods they used were so extreme, so precise, and so medically sophisticated that scientists are still not entirely sure how they pulled it off. Let's start with what ancient humans actually saw when someone's mind broke down. They had no concept of the brain as the source of thought and behavior. For most of human prehistory, the mind was not in the head. It was in the breath, the blood, the stomach, or somewhere outside the body entirely. So when someone started hearing voices, seeing things, behaving in ways nobody could explain, the conclusion was not medical. It was supernatural. Something had entered this person. A spirit, a dead ancestor. A force from another world had taken up residence inside this human body and was driving it somewhere nobody wanted to go. This wasn't ignorance. It was the most logical explanation available. The person looked the same on the outside. No wound, no infection, no obvious physical cause. But they were clearly not themselves anymore. Something invisible had changed them. And if the cause was invisible, the solution would have to reach the invisible world. That's where the shaman came in. Every ancient human group we have archaeological evidence for had some version of a specialist. A person whose job was to move between the human world and the spirit world. To go where ordinary people couldn't go, retrieve what had been lost or invaded, and come back. We call them shamans. But in their own communities, they were the closest thing to a doctor, a therapist, and a priest all compressed into one person. The evidence for shamanic practice goes back at least 30,000 years. In caves across Europe, Africa, and Asia, archaeologists have found ritual objects buried with specific individuals. Cave paintings showing half-human, half-animal figures. The classic representation of someone moving between worlds. In one burial site in the Czech Republic dating back 26,000 years, a woman was found surrounded by objects that marked her as a ritual specialist, buried with care, with intention. In the Shanidar cave in Iraq, researchers found a Neanderthal burial from 60,000 years ago. He had a healed broken arm, was blind in one eye, had severe arthritis. He couldn't hunt, couldn't fight, but his group kept him alive for years past the point his injuries would have killed him alone. Ancient humans took care of their broken members, not occasionally, structurally. It was how they survived. But the shaman's tools went beyond ritual and community care. Because some ancient humans looked at a person whose mind was failing and came to a conclusion so extreme that when modern scientists first discovered the evidence, they assumed they were looking at something else entirely. They decided to open the skull. Trepanation is the oldest surgical procedure in human history. It involves drilling, scraping, or cutting a hole through the skull of a living person. It has been found on every inhabited continent: France, Peru, Russia, China, Kenya, the United States. The oldest confirmed example dates back 7,000 years. When archaeologists first found these skulls, they assumed the holes were made after death. Some kind of ritual. But then they looked at the bone edges more carefully. The holes had healed. New bone growth around the edges. Smooth, rounded, regrown. These people were alive when the hole was made, and alive long after. Some skulls show multiple holes at different stages of healing. The same person went through the procedure more than once and survived each time. At one site in Peru, researchers examined 800 skulls. Roughly 40% showed trepanation. Survival rates in some periods reached 90%. 90%. No anesthesia, no antiseptic, no antibiotics, no surgical steel. Stone tools, sometimes shell or obsidian. Someone 7,000 years ago figured out how to cut open a human skull, do something inside, close the wound, and keep the patient alive at a rate a modern trauma surgeon would find acceptable. So why did they do it? Many of the skulls showed no evidence of physical trauma, no battle wounds, no fractures, nothing that explained a surgical intervention. The leading theory is that trepanation treated conditions we'd now call neurological or psychiatric. Severe headaches, seizures, hallucinations, behavior that looked like spirit possession. The logic was sound given their framework. If a spirit had taken up residence inside this person's skull, you opened the skull and let it out. Whether or not that logic was correct, the procedure worked on something. People survived it, repeatedly, and they were buried afterward with care, surrounded by grave goods, honored as community members who had been through something and come out the other side. Not discarded, honored. Here is what this tells us that changes everything. For most of recorded history, mental illness meant abandonment. The mad were feared, isolated, locked away. In medieval Europe, believed to be possessed by demons. In the 18th century, chained to walls and institutions and displayed to the public like zoo animals. This was considered civilization. And yet 7,000 years before any of that, people with no formal education, no scientific framework, and no metal tools were performing brain surgery on sick community members at survival rates that would embarrass some modern procedures. The difference wasn't knowledge. It was intention. Ancient humans looked at someone whose mind was breaking and thought, this person is one of us. Something happened to them, and we are going to try to fix it. Even if fixing it meant cutting open their head with a piece of flint. The brain hasn't changed. The conditions ancient shamans were treating, the hallucinations, the voices, the profound disconnection from reality, are the same conditions psychiatrists treat today. Schizophrenia, psychosis, epilepsy. They were there 300,000 years ago. They have been there every single generation since. And for most of that time, people whose minds worked differently weren't seen as broken. They were seen as touched by something beyond the ordinary. Shamans were often chosen from those who had experienced what we'd now call psychosis and survived it. The person who had seen the other world and come back was the most qualified to go there again. The experience we now medicate was once considered a door. You come from a long line of people who gathered around the one who was suffering, who built rituals and procedures and communities of care across 300,000 years, before anyone invented a hospital, before anyone had a name for what was happening. They didn't always get it right, but they never stopped trying, and neither have we.